The negative effects of abortion on women's psychology. 1. The psychological risk factors associated with abortion. In the United States alone, there are approximately 1.3 million abortions a year. However, many people don't know that abortion has been associated with various psychological risk factors. This article will discuss post-abortion stress disorder, which is a condition that can occur after an abortion and can be characterized by symptoms of depression and anxiety. It will also talk about the role of mental health professionals in helping those who suffer from this condition. Post-abortion stress disorder, PASD, is a psychological response to abortion that may include anxiety, depression, anger, guilt, or shame, which may be triggered by external reminders of the abortion, such as seeing an infant or hearing a baby cry. Symptoms of PASD may vary in intensity over time and between individuals. For some women, it may last for only a few days, whereas for others it can last for many months or even years. PASD is often characterized by feelings of anger, guilt, and shame. It is most common in the first year following an abortion, but may occur anytime from 1 to 5 years later. Women who experience PASD often have difficulty concentrating and remembering things. Two, where do U.S. ladies remain on early termination? Surveys show that 69% of ladies accept that there should be huge limitations on fetus removal. The surveying viewed that 69% of ladies accept that fetus removal ought to be accessible, probably, during the initial 3 months of pregnancy, permitted exclusively in instances of assault, incest, or to save the existence of the mother, or never allowed. The surveying showed that 37% of ladies accepted that early termination ought to just be lawfully allowed in instances of assault, incest, or to save the existence of the mother. A further 21% of ladies accepted that early termination ought not to be legitimate after the 3rd month of pregnancy. The surveying likewise found that a larger part of the people who call themselves favorable to the decision, 52%, accept that early termination ought to be accessible, probably, during the initial 3 months of pregnancy, permitted exclusively in instances of assault, incest, or to save the existence of the mother, or never allowed. Furthermore, 82% of American ladies believe that it is feasible to have regulations that safeguard both the well-being and the existence of her unborn youngster. 76% of individuals who see themselves as favorable to the decision and 79% of individuals who distinguish as Democrats concur. Three, brief information about abortion. Abortion is a controversial issue and often a subject of debate. It is also one of the most common medical procedures in the United States. An estimated 1 in 4 women will have an abortion by the time they are 45 years old. To understand how abortion has been handled legally over the years, it's important to know what it is. Abortion is defined as the termination of a pregnancy after, accompanied by, resulting in, or closely followed by the death of the embryo or fetus. This can be achieved through surgical procedures or through medications that end a pregnancy. There are 2 main types of abortions: medical and surgical abortions. Medical abortions involve taking medication that ends a pregnancy, while surgical abortions involve surgery to remove an embryo or fetus from the uterus. 4. What is post-abortion stress disorder, PASD? Post-abortion stress disorder, PASD, is a mental health condition that can occur after a woman has an abortion. It can include feelings of guilt, shame, depression, anxiety, and anger. The symptoms of PASD are not always the same for everyone. Some people may have few or no symptoms at all, while others may have many different symptoms such as guilt, low self-esteem, depression, anxiety, anger, fear of abandonment or rejection from friends and family members. 5. How should psychological support be given to a woman with post-abortion stress disorder, PASD, by her family? PASD is a type of depression that can occur after an abortion. It is characterized by a variety of symptoms, including mood changes, sleep disturbances, and anger outbursts. This condition can be treated with psychotherapy or antidepressants. The family members should be supportive of the woman with PASD and help her to recover. They should not blame the woman for the abortion or make her feel guilty about it. The family members should understand that it is a natural response to unwanted pregnancy and not an indication of weakness on behalf of the woman. 6. Circumstances that make abortion mandatory. Several circumstances make abortion mandatory. These include rape or incest, when the woman's life is in danger, when the fetus has severe abnormalities, when the pregnancy poses a serious risk to the woman's physical or mental health, if there is no chance of the fetus being born alive. 7. Psychological support to be given to women after unwanted abortion. It is important to offer psychological support to women who have undergone an unwanted abortion. This is because the procedure can be traumatic and cause a lot of mental stress and anxiety. Some of the symptoms that a woman may experience after an abortion are depression, anger, guilt, shame, fear, and worry. These symptoms can lead to self-harm or suicide in some cases. Healthcare providers need to be aware of these risks so they can identify signs of mental stress in their patients as soon as possible and provide them with adequate support. And counseling. There are a lot of psychological struggles that can arise after an abortion. Some common reactions are guilt, shame, fear, and worry. These reactions can lead to self-harm or suicide in some cases. 8. What are the behavioral attitudes towards a pregnant woman? In the United States, there is a shift in the attitude towards pregnant women. In the past, society has been more negative towards pregnant women. They were seen as being weak and vulnerable. In recent years, there has been a change in attitude. There are more positive attitudes towards pregnant women and they are seen as powerful. 9. What are some comforting words for pregnant women? Some words that may be comforting to pregnant women are, "You're doing an amazing job. It's okay if you don't know what to do. I'm here for you." You need to make sure that you say these sentences from your heart.